I'm giving hydrolyzine, 20 milligrams IV push now, it's the medication I drew. And for Frank Miller, I have hydrolyzine, 20 milligrams IV push now, expires 2020. I also need 2 normal saline flushes. First one for Frank Miller, 0.9% normal saline, IV push. We are giving that now along before and after the medication. Expires 9/3/19. And my second flush for Frank Miller, 0.9% normal saline, IV push now again, giving before and after, and expires 8/11/19. I will need a syringe and a needle to drop my medication, as well as an alcohol swab. So hydrolyzine, it is 20 milligrams is within the safe dosage amount. It is available 20 milligrams per milliliter, so I will be giving 1 milliliter. I need to assess blood pressure and pulse frequently, as well as check the CBC and electrolyte labs. I'm going to be administering this over at least 1 minute and monitor blood pressure and pulse frequently after the injection is over. Wash my hands. Instilling 1 milliliter of air. And drawing up 1 milliliter of medication. I will need to label my med. Hydrolyzine, 20 milligrams per milliliter, expires 5/20/20. And place on my syringe. I noticed that we do have markers here. I would use a marker so that it can't be erased or smudged. Alright, so we have for Frank Miller, we have hydrolyzine, 20 milligrams. We are giving that IV push. We are giving that now. It expires 5/20/20 as indicated on the bottle. For Frank Miller, we have 0.9% normal saline. This comes in 10 milliliter flushes. IV push, we are giving this before and after the medication is administered. Expires 8/11/19. Frank Miller, again, 0.9% sodium chloride for the after flush. Comes in 10 milliliters. Expires 9/3/19, giving that IV push now. So I'm ready to enter a patient's room at this point. I will take my MAR with me, take my 2 flushes, and my labeled syringe medication. Knock, knock, knock. Hi, my name is Caitlin. I'm going to be your student nurse. Place my items on a clean, dry surface. Wash my hands. Close the door behind me for privacy. Can you state your first and last name as well as your date of birth for me? I would verify his name band with what he's saying as well as what is on the medication administration record. Also, do you have any allergies that I should be aware of? Patient would indicate allergies. I'd also look for an allergy band. Allergies are penicillin and Lipitor, which is not going to affect this medication. Grab gloves for later. Before administering this medication, I would want to check his blood pressure, pulse, as well as again monitor and look at his latest CBC and electrolyte labs. Third check, we have Frank Miller as indicated. Frank Miller, hydrolysine 20 milligrams in 20 milliliters. We are giving that IV push now. Expires 5/20/20. For Frank Miller, we have 0.9% sodium chloride or normal saline. Comes in 10 milliliters. IV push now, expires 8/11/19. Frank Miller, we have our second flush, 0.9% sodium chloride or normal saline. IV push now after the medication administration. 9/13/19 is the expiration date. This is an antihypertensive, so if the MAR indicated any doctor's orders on whether to hold the medication, if numbers were within a certain range, I would check that and verify. Medication is safe to be administered. Alright, so I'm just going to assess the IV site. Mr. Miller, do you have any pain or tenderness around your site? Wait for a response. I don't see any redness, signs of infiltration or phlebitis. I don't see any drainage. Dressing is clean, dry, and intact. Area around the site is warm to the touch, not hot or not cold, within normal limits. I'm going to get the air out of my syringe. There's quite a bit of fluid in here. It would not be that way. They were overfilled. So I put them to 10 milliliters and got the air out. So I was giving the proper amounts. First, I'm going to scrub the hub for 15 seconds. My first flush is going to be between 3 and 5 milliliters. Unclamp. Would aspirate for blood return and push 3 to 5 milliliters of normal saline into his IV. Positive pressure and This we will be administering over 1 minute to unclamp. And I'd ask my patient how his day's going, how he slept, if he had anything to eat for breakfast if it was in the morning, as well as looking at his IV site to make sure there's no change while administrating. We also will be administering the 1 milliliters of normal saline over a minute. Alright, it has been a minute. I will finish with an additional 3 to 4 milliliters. Holding positive pressure. Right. I would clean up my area at this point. I would remove my gloves, wash my hands, lower the patient's bed to its lowest position, give my patient his call light, ask Mr. Miller if he needs anything at this moment, but also remind him that if he has to go to the bathroom, this medication can cause dizziness, drowsiness, or a drop in blood pressure upon rising. So please call me or the CNA for assistance so we don't have any falls. That is all set. Again, clean up my area. As I exit the room, I would document my information. Just going to wash my hands again before. So I'm documenting on 1/23/17 at 11:56. Hydrolysine, 20 milligrams given. IV over 1 minute. Patient tolerated. Procedure well. And my name and credentials.